There are now more people in hospital with COVID-19 in England than there was during the peak of the crisis in April. And some hospitals say that they are close to breaking point. At one hospital in East London, ambulance units say that people were kept inside ambulances for up to 6 hours before they could be transferred into wards. And at another hospital in the south of the capital, people had to be transferred from that hospital to another one because of fears that the hospital was running short of pipes and infrastructure to deliver oxygen. The NHS says that the situation is serious and has delivered this warning.
Many of us will have lost family, friends, colleagues, and at a time of year when normally we would be celebrating, a lot of people are understandably feeling anxious, frustrated and tired. And now, of course, again, we're back in the eye of the storm with this second wave of coronavirus sweeping Europe and indeed this country.
The UK has started vaccinating healthcare workers and those aged over 80. But the country is waiting for the Oxford AstraZeneca vaccine to be approved so it can massively scale up its program. And one study has found that the UK will need to vaccinate 2 million people every week if it's going to avoid a third wave.
By late spring, we think that with vaccine supply continuing to come on stream, we will have been able to offer all vulnerable people across this country this COVID vaccination. And that perhaps provides the biggest chink of hope for the year ahead.
Right now, hope is in short supply. During the first wave, the British government set up temporary hospitals called Nightingales to back up the NHS. But most of these have never been used because there isn't enough staff. And with a new strain, highly infectious strain of COVID-19 sweeping across the country, infections are soaring. Most of England is under a Tier 4 restrictions and tougher ones could be coming. Nicole Johnston, CGTN, London.